Well, thanks for being with us on News and Views, and welcome to North Carolina.
Thanks so much for having me.
Let's talk about the report. It's really interesting. We hear a lot about Medicaid helping individuals, but it's a new, interesting take to talk about how much it helps families.
That's right. You hear very little about this in many states that are debating the issue of Medicaid. And so the point of this report is really to point out that this is an issue in which children and their families have a lot at stake. And there are a number of reasons for that. Parents stand to benefit directly from this expansion by getting covered. But children will benefit in many ways too, and that's what this report talks about.
So who are we talking about? I think people also have a stereotype in their mind when it comes to Medicaid expansion.
Yeah. So what our report found is that over a quarter of those who would immediately gain coverage are parents who have children in the home. So that's a significant minority, but also remember that we're talking about covering women of childbearing age with this expansion. So you have women who may not be parents yet, but we know from lots of research that it's important for them to be healthy before they get pregnant as well. And you also have folks in this population who may have children that are now out of the home and are also parents, but 27% are parents with kids in the home. Typically, those parents are working, about 2/3 of them are working, and also most commonly they have school-age children. And that's important because school-age children tend to have higher rates of uninsurance, and covering parents, in fact, will help cover those kids as well.
And when you say the parents are working, I think a lot of people will be surprised to hear that. They think of, it's hard to imagine for a lot of middle-class folks who have health care on the job or who have other ways to provide it, that they're actually people who go to work every day and have no health insurance.
That's right. And what we found in our report is that the top industries where these folks are working are the restaurant industry, food service, retail, and actually healthcare, funnily enough. Depressingly enough, a lot of home care workers, people go into that field, don't have health insurance for themselves. So we're talking about low-wage working families who are working, but their employers are not offering coverage. And